Welcome to the Deep Dive. We are here to give you the shortcut to being well-informed, and today we are tackling a real paradox. As we're all in this period of, holiday cheer and family time, there's this huge industry that enters one of its most stressful, most demanding periods. I'm talking about the healthcare system.
Yeah, that's absolutely right. We're sort of peeling back the curtain on what people in the industry call the holiday effect. And it's not just a feeling. It's not just, oh, it's busy. It's a quantifiable problem. You've got this collision where patient demand just shoots up, flu, accidents, you name it. And on the other side, staff availability just completely plummets. People are on PTO. They're already burned out.
Right. So our mission today is to go beyond those anecdotes and actually quantify the risk. What does this period do to patients, and what does it do to the providers who are, holding the line? For this deep dive, we've pulled some really significant sources, massive studies on patient outcomes, reports on physician well-being from the AMA, and some really interesting case studies on staffing.
And the core question is, okay, is this real? Does working through the holidays actually put people at risk, or is it just perceived stress? The data, especially around what happens when a patient goes home, tells a pretty sobering story.
Okay, let's unpack this then. Let's start with the patient, because the numbers here are frankly shocking. This is the high cost of a holiday discharge.
Right. So we have to look at this huge study out of Ontario, Canada. They tracked over 670,000 patients who were urgently admitted over like a 14-year period. And they compared patients discharged during that 2-week December holiday window to patients discharged in, say, late November or January.
And what's so striking to me is that the biggest failure point they found wasn't about the care in the hospital. It was the complete collapse of the support system the moment they walked out the door.
Precisely. The core failure was a dramatic lack of follow-up care. Think about it like this. Normally, about 47.8%, so almost half, of these discharged patients would see a doctor within 7 days.
Which is critical.
It's essential. But during the holiday period, that number dropped to just 36.3%.
Wait, so that safety net, that immediate check-in shrinks by almost a quarter?
Yeah.
Just because of the time of year. You're talking about people who need wound checks or their medications adjusted, life-sustaining stuff.
Exactly. And when you lose that check-in, the danger it compounds fast. And it had real consequences. Patients discharged during that holiday window were at a higher risk of death or readmission within 30 days. The rate jumped from 24.7% to 25.9%.
And for anyone listening who thinks a 1.2% difference sounds small, the researchers translated that. The adjusted odds ratio was 1.09. So your risk of a bad outcome, dying, or ending up back in the hospital is almost 10% higher, just because of the date on the calendar.
And this is where it gets really interesting, because we can actually quantify that extra burden. For every 100,000 patients discharged over the holidays, the system created, get this, 26 excess deaths.
Wow.
188 excess hospital admissions, and nearly 500 excess ER visits.
So by just slowing down the outpatient world, the system is actively creating hundreds of severe avoidable events. It's a direct consequence of that downtime.
And you can see this effect starting even before the patient goes home. It's about the continuity of care inside the hospital walls. One study looked at something they called the holiday ratio.
The ratio being, what, the number of holiday days that fall during your hospital stay?
Exactly. The number of holidays divided by your total length of stay. So say you're in the hospital for 10 days recovering from colon cancer surgery, and 4 of those days are holidays. Your ratio is 0.4. They found that a ratio greater than 0.3 was an independent predictor of a potentially avoidable readmission.
Which suggests that the quality of care you receive during your stay actually drops if too much of it happens over a holiday.
It does. It all comes down to handoffs. During holidays, senior doctors, specialists, they take time off. So you get this rotating cast of covering providers. And every single handoff is a chance for something to get missed. A test result, a physical therapy session. That inconsistency hurts recovery.
So the risk is twofold. It's inside the hospital because of messy handoffs, and it's outside because the safety net is gone. That really frames the stakes. So let's shift to the drivers. Why is demand so high and staffing so low? What creates this perfect storm?
Well, the patient surge is, it's very predictable. First, you have the respiratory season, flu, RSV, COVID. They all spike and drive people to the hospital.
And then you layer on what you could call the festive factors.
Right. Holiday travel, accidents from decorating. The Consumer Products Safety Commission reports thousands of injuries every year from people falling off ladders, hanging lights. It sounds silly, but it's real.
And then there's the The financial reason.
The financial driver, which we have to talk about. It's the end-of-year deductible rush. People have met their deductible, so they rush to get procedures done before January 1st when it all resets.
That makes perfect sense. So you're straining the front lines, scheduling, triage, right when those departments are at their thinnest.
Which brings us to the other side of the equation. Fewer staff. It's not just that senior people book their time off. It's that unplanned absences go way up. Nurse call-outs, for example, can increase by up to 30% between Thanksgiving and Christmas.
And the staff who are left are just operating in this high-risk, high-demand environment with almost no backup.
And the psychological toll is just. It's severe. Surveys show a huge majority, somewhere between 54% and 75% of healthcare workers report more stress during the holidays. The system is just constantly running in the red.
I saw a 2022 study where 40% of nurses, 40, reported severe emotional exhaustion during that holiday period. That's not sustainable.
It's not. And we also have to mention the safety risk for the staff themselves. Overcrowded ERs, long waits, high emotions. It's a recipe for workplace violence, which is already a huge problem in healthcare.
It's a total pressure cooker. Okay, let's zoom in on the doctors, specifically hospitalists, the ones who have to be there 24/7. Their big challenge seems to be this inability to ever really switch off.
That's the digital tether. It's the electronic health record, the EHR. The technology is necessary, but it means that roughly 70%, 70 of physicians report doing patient care tasks while they're technically on vacation.
70%. So even when they're supposed to be resting, they're still tethered to their inbox. What are they even doing?
It's not optional stuff. It's managing critical lab results that can't wait. It's answering messages from other doctors about a patient. It's signing off on discharge summaries. All these things pull the physician right out of that restorative rest and back into the clinical mindset. You're never truly off.
And we could actually measure the damage that does, right?
We can. The data shows that spending just 60 to 90 minutes on these tasks during a vacation nearly doubles the risk of burnout compared to someone who fully detaches.
Doubles it. So that 1 hour of work basically ruins the entire point of the time off.
It erodes it completely. And what's fascinating is that the fix for this isn't, telling doctors to be more mindful. It's structural.
It's not on the person, it's on the system.
Exactly. The single biggest predictor of lower burnout is full EHR inbox coverage. When another colleague is designated to handle all that incoming traffic, the doctor on vacation can actually truly rest. It's an organizational choice.
Which brings up this really critical question of fairness, especially for hospitalists. Your typical outpatient doctor gets, 10 paid holidays because their office closes. A hospitalist, their holiday shift is just treated as part of the rotation.
That's the disparity. It creates this feeling that you're being penalized for choosing a field that has to run 2004/7. Why should one doctor get a paid day off for Christmas while another is expected to work it for no extra compensation or time back?
It's a huge source of resentment, I'd imagine. You're giving up family time during the most important days of the year, and the system just treats it like another Tuesday.
Right. And advocacy groups have made a really good point here. They argue that hospitalists should get an equivalent benefit, something like 6 holiday shift credits a year, to create parity with their outpatient peers. It's about recognizing that sacrifice.
Okay, so let's move from the problems to the solutions. How do the best organizations actually manage this surge? Let's talk systems, not just individual resilience.
Well, the first thing is they don't wing it. They use historical data patient volumes, flu trends, absentee rates to forecast their staffing needs months in advance. They know it's coming.
So once they have that forecast, how do they fill the gaps without just burning out the people they already have?
They use flexible staffing models. One of the big ones is a float pool. These are cross-trained staff, usually very experienced nurses, who can move between high-demand units. So if the ER gets slammed, they can float staff there. If the ICU spikes, they move them there.
It's built-in flexibility. And what about bringing in outside help?
That's where per diem or PRN staffing is key. You hire temporary staff just for those peak days right before Christmas, right after New Year's. It gives you surge capacity without the long-term cost.
I also saw a lot in the sources about using remote work to offload some of the burden.
Oh, that's critical. Using virtual assistants or remote support for things like scheduling, intake, and especially post-discharge follow-up calls, it's huge. If you don't do that, all that administrative work just piles up, and January becomes this massive cleanup effort that just starts the next cycle of burnout.
And what about the psychological side of it? How do you support the team when they know they're heading into a really tough couple of weeks?
Organizational compassion is everything. One great model is holding resiliency discussions a few weeks before the holidays. It's a chance to be transparent about staffing, to get people's preferences for time off, and just to set realistic expectations.
So it's about giving them some control, some agency, instead of just dropping a brutal schedule on them.
Exactly. And then you follow it up with tangible rewards bonuses for working those tough shifts or just fostering a sense of community, like having meals catered for the staff on Christmas Day. And for patient safety, it's all about leaders being visible, reinforcing communication, and making sure everyone sticks to protocols, especially during handoffs.
So to wrap this up, this deep dive really shows the holiday effect isn't just about stress. It's a systemic problem. It's driven by these massive coordination failures, like the lack of follow-up care and this intense psychological strain from things like the digital tether and just a total lack of control.
Right. And if you connect it to the bigger picture, it shows that the solution isn't asking people to be more resilient. The solution is giving them autonomy over their schedule and protecting their time off with things like full EHR coverage. You have to fix the system, not the person.
Which leads us to our final provocative thought for you, the listener. We know with statistical certainty that discharging a patient from the hospital during the holidays is riskier. The follow-up care system just isn't there. So if the system is designed to fail patients in December, what is the moral obligation of hospital leaders? Is it enough to just try and improve staffing? Or should they go a step further and temporarily pause or redesign the entire discharge process during those peak holiday weeks? Maybe even delay some non-essential discharges until the outpatient world is back online.
That's a wrap on this deep dive.